Parasites that can live inside your pets. Roundworms. Both cats and dogs can be infected by roundworms. They acquire them by ingesting soil/feces contaminated by eggs and larvae or by eating infected rodents, birds, and insects. Puppies and kittens are often infected by the mother while still in the uterus. They can also be infected while nursing. Diagnosis can be made by finding eggs by microscopic exam of the feces or by seeing adult worms voided in the feces or vomit. Larval forms can migrate through the lungs and cause a condition known as verminous pneumonia. Hookworms. Hookworms are a serious parasite of cats and dogs. Pets acquire them by ingesting infective larvae or by the actual penetration of larvae through their skin or feet. They can also be transmitted by the mother during pregnancy or through nursing. These parasites can only be found by microscopic exam of feces. Hookworms attach to the intestinal lining and feed off the blood of their host. They can cause severe enough anemia to cause sudden collapse and death, especially in young, weak, and malnourished animals. Other animals may show a slowly progressive wasting disease. Whipworms. Whipworms are small, thin worms that live in the large intestine and cecum of dogs. It is extremely rare in North American cats. Dogs acquire them by ingesting eggs from contaminated soil/feces. These eggs are very resistant and can live in the soil for 5 to 7 years. Infection can only be detected by microscopic exam of the feces. Eggs are shed in low numbers, thus, it may take several stool sample exams to be detected. This can make diagnosing a whipworm infection difficult. Whipworms can cause diarrhea, bloody stools, weight loss, and poor general health. Tapeworms. There are several species of tapeworms. Both cats and dogs can be infected. The most common routes of infection are by eating small rodents/rabbits or by ingesting fleas which carry the infective stage. Tapeworms live in the small intestine with their head buried in the lining. They are relatively harmless to your pet, but can cause mild GI upset on occasion. Tapeworms can be difficult to diagnose on fecal exams as the eggs are often passed in the packets. These segments can be seen in your pet's feces or coming out from the anus. They will also sometimes stay connected and appear as a long, flat ribbon-like object. Coccidia. Coccidia are single-celled organisms that infect the intestines of dogs and cats. They can only be detected by microscopic exam of your pet's feces. Your pet becomes infected by ingesting contaminated dirt/feces or intermediate hosts such as mice. This parasite is especially common in young and stressed animals. It causes bloody, watery diarrhea and sometimes death, especially in young animals. There are no products to kill the organism. Treatment is aimed at stopping reproduction of the organism so it is easier for the patient's immune system to take over and fight off the infection.